People out there are making mistakes when it comes to Medicare. And unfortunately, with the government, if you make a mistake, sometimes it just might cost you for the rest of your life. And Social Security, Medicare is not forgiving. So it's very difficult to go in there and say, well, I didn't know. I ran the third busiest Social Security office in the country, and unfortunately, we had a lot of people come in. And they say, "Well, I didn't know I was supposed to enroll at this time or that time or whatever the case may be." And unfortunately, yeah, they're not forgiving. So we're going to make sure. I've got Thomas here from Chapter. He is represents Chapter there, and Chapter is the go-to organization for y'all to get help with all things Medicare supplements, Medicare Advantage, Medicare Part D, and they help people throughout the country, and they've done a phenomenal job. And I think Thomas just woke up from 48 hours of sleeping after December 7th. So we just finished the annual enrollment period, which started October 15th and lasted to December 7th. And they pretty much work 24 hours a day, I think it seems like, to get through all those. There was what 1.8 million people that had their Medicare Advantage plans canceled for 2025. There's a lot of companies out there that decided to pull out of particular areas. I think one pulled out the entire state of Missouri, and but all throughout the country, you've got different companies pulling out, and they just said, "You're canceled. Bye. Go fend for yourself." So there was a lot of people needing help this time. It was probably the one of the craziest Medicare seasons we probably had in decades. And Thomas and his team went through it and got through it in flying colors. So welcome, Thomas.
Oh, well, thank you for having me, Dr. Ed. It was a incredibly busy season from plans exiting to the Part D changes that took place. We're thankful to have a little bit of a breather the next couple of weeks, but 2025 is still rolling ahead.
Yep. Yep. All right. So we're going to talk about so December 7th wasn't I guess December 7th is kind of an interesting day in history. I'm not sure why they picked December 7th, 1941. But anyway, it's not really a D Day, but that's a whole different day, Normandy. But yeah, December 7th wasn't the only time you can change your Medicare Advantage. It is for particular situations, but there are a lot of other opportunities to change your Medicare Advantage plan, your Part D plan, your Medicare supplement plan. So we're going to talk about that today, and to make sure that you're getting everything you're entitled to, and you make sure you don't make a mistake. And remember, this is a live Q&A as well. So we're going to go through the questions. If you got any questions about your specific case, because there's always exceptions to the exceptions, go ahead and type it in the live Q&A chat there, and we'll get to as many as we possibly can. Okay, so let's so the AEP is over, but that doesn't necessarily mean there's no more changes. Is that correct, Thomas?
That is correct. Clients will have an opportunity to change depending on their situation, potentially throughout the year, potentially during a special enrollment period event that may be available to you, or if you're somebody that has a Medicare supplement plan, you can do that 365 days of the year if you can get somebody on the phone.
All right. So yeah, so this is so talk so get a lot of people, particularly with all the news and everything about Medicare Advantage. And I always tell everybody, if you're new to Medicare, you're turning 65. What is it? Got the silver tsunami coming. 11,000 people are turning 65 every single day. I think something happened after World War II, 1946 to 1964. Over 70 million people were born during that time. So those people, if they're lucky, they're getting old, and they are turning 65, and they have to come up with that decision on what they're going to do with Medicare. You don't necessarily have to sign up for Social Security at 65. You can, if you want. You can start your Social Security retirement benefits as early as 62 years old, spouse benefits as early as 62 years old. But then when 65 comes around, if you're already receiving Social Security benefits, they essentially sign you up automatically for Part A and Part B when you turn 65. About 100 days before you turn 65, Medicare will send you your package, and it'll have your Medicare card in there with A and B and all the, Medicare and You book and all that kind of good stuff. What I see happening is people throw it away because when you turn 65, everybody in the country knows you're turning 65, and they want to take you to the Medicare prom. They want to sign you up for originally, for Medicare for the first time. So people are getting, so much junk mail and emails and phone calls. And what I see happening is people just, if they see something in the mail that says Medicare, they immediately just throw it away. Or in the old days, I guess we used to wrap fish in it, right? But I see people throwing away the official Medicare book with their card in it, and then about a year later, they realize, "Oh my gosh, I've been paying for Medicare for a year, and I really didn't need it." So why don't people? What type of people? In what situations do you not need to sign up? Can you deny, refuse Medicare when you're 65?
Sure, that's a great question to ask, and it's going to depend specifically on your situation. So, if you're somebody that's turning 65 and you're already taking your Social Security benefit check, they're going to automatically enroll you in Part A and Part B, or at least that's what's supposed to happen. So, if you don't need Medicare because you have creditable coverage elsewhere, which could be federal employee retirement benefits, it could be you're still working and you have credible coverage there with an employer over 20 employees, you'll need to fill out a specific form with Social Security to undo that enrollment for Part A and Part B. Now, if you're somebody that is turning 65 that's not actively enrolled in your Social Security benefit check, they're not going to also automatically enroll you in Part A and Part B. You have to actually physically go on the computer, call in, or go into the Social Security office to apply, which if you're again somebody with credible insurance coverage, then you can potentially delay that act to the time where you do need Medicare, which at that point you would just simply need to prove that you've had coverage from the time that you turn 65 to the time that you need Medicare to start.
Perfect. So that's a credible coverage, but basically that you're currently working, have health insurance from current work, yours or your spouse's current work, and the group health plan has to have 20 or more employees, right?
Exactly.
Right. And there's some people that go ahead and they refuse Part B, but they keep A. Why would someone keep A if they're going to pay for it?
So, a couple of reasons why. Part A, if you've worked, you're required 40 quarters, which most people look at as 10 years in the United States, and you qualify for Part A at zero premium. And why most people go ahead and take that is because it'll establish a Medicare ID number for you that'll follow you for the rest of your life. And it makes it incredibly easier and a much quicker process to get Part B and the rest of your coverages when that day comes that you need to pick up the premium paying aspect of Medicare. So, most people will go ahead and take Part A for the simplicity there and for the ease of enrolling later for the other coverages. Now, one caveat I will say to that, Dr. Ed, is if you're considering taking Part A, just make sure you're not also making contributions to an HSA, also known as a health savings account. Otherwise, you're going to have some penalties on the back end for doing so.
Yeah, you have to stop your HSA, stop contributing to your HSA 6 months before your Part B start your excuse me, your Part A starts. And unfortunately, the Social Security employees won't tell you that because most of them don't really know that. They're not really trained for that because that's more of an IRS thing. If you go into Social
Mhm.
Security and say, "Hey, I want to sign up for Part A and Part B or both of them," they'll say, "All right, well, we'll sign you up. Easy, no problem." They won't ask you about an HSA or anything like that because that is just an HSA is between you and the IRS. You're getting some type of tax benefits because you're contributing to an HSA. So unfortunately, a lot of people get kind of a nasty letter from the IRS and say, "Hey, you contributed and you weren't supposed to during the 6 months before you had Part A." Um, and that doesn't mean you can't start pulling out. You can take distributions from the HSA. You just can no longer contribute to it. So a lot of people miss that. And so yeah, so in terms of Part A, another reason I see a lot of people taking Part A when they have already got health insurance from work is if they have a deductible from their work plan that is more than the deductible for Part A. Sometimes Part A will go ahead and go in there and pay for part of that deductible. So if you got like a $10,000 deductible for hospital from your health insurance, you sign up for Part A, and the deductible next year is what $1,676. So and considering it's Part A is free for 99.9%. And the people it's not free for is people that just didn't pay into Social Security, Medicare enough, that didn't pay the 10 years, and they have to pay a premium for Part A. But most people, 99.9% of people, get Part A, zero premium. I always hate to say the word free because
Yeah,
you
we
paid.
avoid that word.
Yes, exactly, because you paid for it, number 1, through your FICA taxes. FICA includes Social Security, Medicare. You paid for decades and decades and decades, and now you're actually getting it. And because there's, deductibles and all the rest of it, it's zero premium. So let's make sure yeah. We wanna make sure we're on the same page, right? Okay, um so you don't necessarily have to sign up for Part A and or Part B, and you can it's kind of like a smorgasbord, I guess. If you're 65, you can sign up for Part A alone. You can sign up for Part A and Part B together. You can sign up for Part A and Part B and refuse the money. You can sign, and wait till you're 67 or 70 to start your money. You can sign up for Part A and the money and refuse B if you have health insurance from work and everything. So there's all kinds of different variables that you can do at 65. If you have health insurance from work, you're happy with it. Your company is not making you sign up for Medicare. Sometimes they do, to save themselves money. So check with your HR. But if you don't have to sign up, people ask me all the time, do I need to contact Social Security or Medicare and tell them no thanks, but no thanks? And no, you don't. No, not at all. So, okay. So that's 65. Got 11,000 people need to make that decision every single day. So hopefully we got 11,000 people, not 11,000 people watching yet. But anyway, we'll get there. So 11,000 people got to make that decision every day of whether to sign up for Part A, Part B. And if they don't get it at 65, then once they stop receiving health insurance from work, if they're 70, 75, 85 years old, current work from their work or their spouse's work, we're not talking retirement plans or COBRA or the Affordable Care Act. We're talking current work. If they're 75, 85 and they stop working, you technically have 8 months to sign up for Part B to avoid any penalties. I always recommend do not wait the 8 months, because that's what happens. When you don't have health insurance for 8 months, guess what? That's when something happens, right? So you technically have 8 months, but it's always recommended about a month or two before you know you're going to lose your health insurance, current health insurance. Go ahead and sign up for Part B, and you'll need what Thomas was talking about. You'll need a couple of forms, the 40B and the 564. The 564 form you take down to the HR, and the HR just signs off it and says, yes, 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 this person had health insurance from work since they turned 65. Don't penalize them, and you won't get a penalty, and you're golden. So don't get a penalty. Don't pay for Medicare Part B, the $185, if you don't need to. And that's the most important thing for those two things. But original Medicare alone is not the best options in terms of just having it, because there's a lot of gaps. So why do people need to do something else to fill in those gaps, and what kind of options do they have, Thomas?
And you're referencing in terms of like Medicare Advantage and Medicare Supplement as far as filling those gaps.
Exactly.
There's quite a few options that you can do, because with original Medicare as it stands, it's only going to give you coverage for 80% of your medical coverage after you've met a deductible. So the deductible is relatively small. It's like 264 next year, or whatever the exact figure is. It goes up incrementally every year usually.
I
But
think it's
what we're
what
looking at,
I got my cheat sheet here. 257 for next year.
257. So we got
Yep.
257 next year for your Part B deductible. And then once that's been exhausted, you have 80% coverage for anything medically related for Part B. So the question is, how do you cover that other 20%? You have two options. Either you go a pay as you go structure, which is what you see advertised on TV all day, which is a Medicare Advantage plan. It wraps everything under one umbrella: your A, your B, your D for drugs, as well as additional benefits for things like dental or vision or whatever it might help make it more well-rounded for you. The reason it's called pay as you go is because it's that HMO or PPO structure where you're going to have co-pays or co-insurances for the services that you end up using. Maybe not so much for the primary care, but certainly for hospital, certainly for lab work and diagnostic radiologies, and certainly for outpatient surgery. So something to be aware of if that's the style of coverage that you do like. Also, keep in mind that they will subject you to a much smaller network than original Medicare because they're regionalized plans and only certain doctors work with certain coverages. So it's very important to make sure that whatever plan you end up choosing works well with your doctors, or be prepared to change those doctors. Now, the other side of it, that's one route. The other side is the pay up front style, which is the Medicare supplement. A lot of folks do refer to that as a Medigap. The reason it's called pay up front style is because you pay an additional premium on top of your Medicare Part B premium to have the other 20% covered. The most popular plan that you'll see out there now for anybody turning 65 is a supplement plan G, because what that covers is all of your Part A financial responsibility, deductibles, co-insurances, co-pays, as well as your Part B co-insurance. The only thing that Plan G does not cover is that one-time deductible for Part B, which for 2025, as Dr. Ed mentioned, is $257. So why do people go that route? It's because it gets you to stay within the original Medicare network, which means that whether you're in California, South Carolina, Florida, New York, you can see any doctor that takes original Medicare and you have the exact same coverage. So leaves you in a lot better control.
Perfect. Yeah, I always say I've said over and over and over on my lives, if you're going to be signing up for Medicare Part A, Part B, once you're on, because you have to be on both of those to get any one of those. You have to have Part A and Part B to get a Medicare Supplement plan, a Medicare Advantage plan, or a Part D plan. Correct?
Correct.
Right. So when you're new, if you have Part A, you don't have to get anything else. But as soon as you sign up for Part B as well, then you're going to start having all those gaps. And it's important that you go ahead and figure out what's best for you. And nobody can tell you what's best for you until they ask you a bunch of questions about your situation. But I always recommend go down the list there. Check out. I kind of prefer Plan N because I'm cheap like that. It really depends on your particular situation, how many times you go to the doctor and everything. But Plan N or G, either one of those is perfect. And then if it's not for you, then go down to a Medicare Advantage plan. And then you got to check your doctors and your prescriptions and all the other things. And that's chapter can help you out with that. They help people throughout the country, and their help is always free. Medicare insurance agent or broker will never charge you to help you find a plan, to help you enroll in a plan. If you go directly to the company and sign up with them, it's the exact same plan and the price and deductibles and whatever the case may be. So it's always good to have someone help you navigate, because you don't know what you don't know. And the great thing about Chapter is they have, that's one of the reasons I chose Chapter. Number one is because they've got great brokers, advisors that help you out, but they also have what's called the member success team. What kind of things can the member success team do for people? And all the people that, as part of my audience out there that called Chapter and they've given glowing reviews of Chapter, and considering how much pressure you all are under, all the people trying to help, I've got nothing but 100% excellent reviews. Um, and that is awesome enrolling you, but we also chose Chapter because of the after service. So what type of after service can you all provide?
Sure. And as with anything, when it comes to Medicare coverages, whether it's Medicare Advantage, Medicare Supplement, or just original Medicare in general, we hope nothing bad or nothing ever happens from a curveball perspective. But that would be naive to kind of say that. There's going to be something that might happen down the road. That's why we have a member success team. They're there for the post effective dates situations that may happen on your policy. You may get prescribed a medication that doesn't get coded in correctly by the doctor's office. Our team of member success agents can help you triage situations like that. It could be a billing situation. Maybe you're moving to a new area and that you didn't get a piece of mail that you were supposed to get and sign off on. They're there to help you with anything post enrollment related that may pop up for you. Now, hopefully, it's a small issue, but occasionally you might run into an issue where your old doctor's office is still trying to bill your old insurance instead of trying to build Medicare. And they don't make it very clear that that mistake was made because all you see is a declination in the mailbox, and it doesn't feel very good to see that.
Right. Get that nasty gram in there. Yeah, I think in January we're going to have your rep from the member success team, because there's going to be a lot of people that have their new plans starting in January. So about the first week or two, we'll have her on, and help people, navigate their new plans for 2025. So I think that's we'll do that here in a few weeks. The end of the year is upon us. Wow, time flies. All
It
right, let's
does.
yeah, when you're having fun, right? Okay. Got some different questions here. I received my 2.5% COLA increase for 2025. It starts in January 25 check for Social Security retirement. Yes, a whole 2.5%. And the way the COLA is calculated, it's not a political thing. The president doesn't decide, how much the COLA is going to be. It's based on the inflation. I think they calculate it wrong, but they've been calculated incorrectly since the 1970s. It's basically the Department of Labor Statistics. They pull the numbers, and they're the ones that come up with it. So it was pulled out of the political sphere back in the 1970s. So it's not, oh, I got this much percentage of COLA under this president. No, you didn't. It's just that person happened to be president during that time, but it's completely apolitical. Um, but I think it definitely should be changed the way they calculate it. But that's a whole different thing. Um, Frank, thanks, Ed, for the call this week and answer my Social Security and WEP questions. I just read that the Senate voted this afternoon to repeal the WEP GPO. Yay. Um, yeah, so many people don't understand the weapon GPO, and it looks as though, yeah, so that's going to cut back Social Security for everybody. That's about close to $190 billion that's going to be taken out of the Social Security Trust Fund earlier. So now we're going to have a tougher time with everybody with Social Security. But I'm going to do a video on that the next couple of days, and so yeah, unfortunately a lot of misinformation out there. He is such a valuable resource and a heck of a nice man. I say we both take that. She didn't Nosy Cat didn't she wasn't specific who she was talking about. So I say we both say yes, thank you, right?
I like that. That's a good approach.
All right, let's see here. All right, so let's see, get some other type of questions here. 1999 SSDI MI supplement C under 65 is hard to change to a cheaper C now or wait until I'm 65. All right, so for people that have Medicare, because once you're on Social Security disability insurance, after being on Social Security disability insurance after 24 months, you get Medicare. But those situations are different, unfortunately, than everybody else that gets Medicare at 65 in terms of their choices. What kind of limitations are people on disability have on filling the gaps?
My goodness, when it comes to under 65 with Medicare supplement, it is so state based because some states require that companies offer certain plan letters. Other states don't even make any kind of stipulations there. So insurance companies won't actually offer Medicare supplements to under 65. The good news is for this particular person, you were able to get a supplement and you got one of the better ones that was offered. Now, for those that don't know, Plan C and Plan F went away for those new to Medicare starting in 2020. So you do have one of the older plans, which means that law of large numbers will start to take an effect, which I think you're kind of referring to with the increases in premiums that you're experiencing on that plan. A recommendation I would do, and of course our team would be more than happy to help with this, is recommendation would be to wait until you turn 65. I believe I caught the state there was Michigan, which is not a guaranteed issue state, which means you would need to go through medical underwriting. And for somebody that's on Medicare under 65, probably not the most fruitful path for you. So wait until you turn 65. You'll have your second open enrollment period for the first 6 months that you are 65 to get something new. I would seriously consider either a plan G or a plan M based on kind of what you're looking into, and of course, from an affordability perspective, I believe the premiums that you would see would be night and day difference, and you're likely going to have better coverage than what you have now.
Yeah, somebody that was on that's on disability, and then they get that new opportunity to go back to original Medicare and get a Medicare supplement. In that case, I would probably, depending on the situation, switch my recommendation. I usually like N, but if you're on disability, you might be going to the doctors more often, so G might actually be a little bit better in that situation. So that's, yeah, that's what we're talking about. It's don't, take your neighbor's advice or your cousin twice removed and, oh, yeah, they love that plan or whatever. It's not for everybody. It really depends on your particular financial situation, your health, how often you go to the doctors, who your doctors, your prescriptions, and all that. So it's important that you check out all of that and look for the best plan. And I heard, Thomas, you all have a couple of people there that can help with that.
Yeah, we got a great team that can definitely look at that.
All right. So, in terms of, okay, Medicare supplement, going back to original Medicare, now that December 7th is over, I'm still getting a lot of people during the live and emails that are saying, okay, I still want to go back to original Medicare because all the stuff, happened in the news and, the denials and delays and prior authorizations. Um, can people go back from Medicare Advantage to Medicare Supplement going forward here?
They can. So let's at least lay the foundation there. So assuming the person is not their first year of being on Medicare, they're 65, where in the first 12 months of being 65, if you will, on Medicare, you would have an opportunity via trial right. That's a very niche type of situation. So for the vast majority of people, your opportunity to go from a Medicare Advantage to a Medicare Supplement plan is going to happen in 46 states via medical underwriting, which means that if you were to work with us, we have kind of 6 preliminary questions that we would ask just to see if you might be a good candidate to go through medical underwriting and experience that. So of course you can sign up for a supplement any time of the year, but what you need to get out of the Medicare Advantage plan is an enrollment period. So for most Americans, that's going to be between October 15th through December 7th, which is annual enrollment period. There is another time a year known as the open enrollment period that you could also look into as well. That's available to you. But again, that is kind of nuanced as well in terms of what's available, what's not. You need to kind of start the year with a Medicare Advantage plan in order to get that. Otherwise, other special enrollment periods may be available out there. So we would just take a look at your individual situation to see if that is possible. But that's a long way to simply say that most likely, yes, we can find a way.
Okay. All right. Yeah. The enrollment periods, it's just crazy because you've got separate type of enrollment periods and limitations and penalties for, part A and part B. And then you have different ones for Medicare Advantage and Part D, and then you have kind of different ones for Medicare supplement plans. So, yeah, and most people out there that worked all their lives in construction, drove a truck, taught school or something like that. They were they could talk around us all day long about their professions, but they just didn't spend a lot of time looking at Medicare supplement plans and Medicare Advantage and the special enrollment periods, and why would they? So it's always good to make sure you're getting everything, because remember, as I say all the time, you paid for all of this. The government is not giving you anything. The Medicare Advantage plans are not giving you anything. The Part D plans are not giving you anything. You paid all of those decades. You paid into Part A. You paid your Medicare tax, through FICA. That pays for your Medicare, and then you're paying your monthly premium for Part B, and then the Medicare Advantage plans. If you sign up for a Medicare Advantage plan, it's not it may be a zero premium plan, but basically, if you sign up for XYZ Medicare Advantage company, that company goes down to Washington D.C. with their cup and they say, "Hey, we just signed up Arleta, and give us Arleta's money." So the government gives that particular company your FICA tax that you paid, and they give them a certain amount every single month. I tried to understand how the calculations work on that, but I broke my calculator. But they give them a certain amount of money every month, every time someone signs up for that Medicare Advantage plan, and so you paid for it. You paid for it in advance, and now your job in retirement is to make sure you get as much money back as you paid into the system as possible. So it's and unfortunately, I wish, it was a lot easier, but it's unfortunately not. So I recommend you definitely get help. If you've got an old high school buddy or a niece or nephew or something like that, then that that helps people with Medicare insurance, then obviously you have to go there, right? Or your Thanksgiving is not going to be happy. But if you don't have someone you trust and are experts in this, then please reach out to Chapter, and they'll definitely help you out. All right, keep smiling. I love the name there. If I change my mind with my Medicare with my Advantage plan, January 1st to March 31st, I called my Advantage plan and they said, "No, you can't switch or change it."
Hmm.
What do you say to
That's
that?
a That's an interesting response that you received from that carrier. What I will tell you is if you start on January 1st with a Medicare Advantage plan, you do have access, if that's something you pursue, called open enrollment period, which allows you a one-time switch into a different plan of your choosing. So, like the short answer is, as long as you start the year with an Advantage plan, you do have the opportunity for a one-time switch if that's what you desire to do.
Yeah, I'm wondering who they contacted. I called my Advantage plan. I don't think the insurance carriers would say, no, you can't switch, because they would get in trouble if they said something like that. I think it may be the person called their agent or broker and possibly didn't want the extra work or confusion or whatever the case may be. So yeah, that's the entire kind of purpose of the open enrollment period from January 1st to March 31st. Kind of it's like for most people, it's kind of a do over. It's a kind of a mulligan, right?
Yeah, it kind of works out that way, which is great for the consumer, and but it's not talked about very often, at least in the thralls of Medicare discussions.
Yeah, yeah. All right. So if this person tries the plan for a few weeks in January, decides doesn't like it, switches at the end of January, when will the new plan take effect?
So anytime you sign up for a new Medicare Advantage plan, it's going to start on the first of the following month if you're using open enrollment period. So if you, in your case, if you sign up for something in January, it would take effect on February 1st.
Okay. All right. What about the people that have Medicaid? So they have the dual eligible plan. I know historically, if you have a Medicare Advantage dual eligible plan, that means you have Medicare and Medicaid. The people that had that were able to change their plans several times a year. Is there any changes for 2025?
There is very important changes happening in 2025. So those that have dual eligibility, which for those that may not know, that's when you qualify for both Medicare and Medicaid. Now, when you have Medicaid through the state that you live in, they're going to provide you what's called a MSP level. And based on that level would indicate what level of dual special need Medicare Advantage plan that you can get. All that's a lot of letters I just threw your way, but what you need to know is if you're in a situation where you're dually eligible, you will have a once a month enrollment period in order to get into what's called an integrated dual special needs plan. And you can reach out to us to kind of figure out what those are if you need help there, or you can reach out to your local state health insurance program, and they can assist with that as well. But the caveat there is we went from a once a quarter shift for those that are duly eligible or had LIS, which is low income subsidy through Social Security. That's gone. What is in place now is an opportunity to go to a integrated dual special needs plan.
Okay. All right. But if they're and there's a lot of people also losing their Medicaid, and it looks as though that might be we're looking. The political rumblings is Medicaid is going to be a target for a lot of political leaders for forever, and I guess also Doge and whatever. But they're talking about maybe doing something with Medicaid. So I know a lot of people have lost Medicaid, particularly during the end of the pandemic. A lot of people lost Medicaid. So if you lose Medicaid and you had a dual eligible plan, so you have a special opportunity to find something else, correct?
That's correct. In the event you lose any kind of coverage from the state Medicaid situation, that would give you a small window, usually 3 months, to apply for a new coverage. Whether in most states that does give you guaranteed issue for Medicare supplement. There are a handful of states that it's not, but again, we can talk about that on a case by case basis. But otherwise, you would choose a Medicare Advantage plan to pick up and become that primary insurance.
Okay. All right. So if you lose Medicaid, there is a possibility you can go to a Medicare supplement plan or go to another rather than a dual eligible plan. You'll have to go to a regular plan. Um, and there's also, as I mentioned, there's the 1.8 million people that have lost their Medicare Advantage Part D plans um, for 2025. Um, some people have mentioned that their letters that said, "Hey, sorry, we don't, like your particular part of the country anymore. We're pulling out, whatever the case may be." And have you seen any of those letters? I guess they're dated. Sometimes they say you got to do it immediately or by December 31st or January 31st. Have you seen any time zones, time frames on those?
Sure. So the time frame would be applicable in a Medicaid situation in terms of like when they tell you you're going to lose the coverage. Like, yes, the letter might be dated, say, November 1st, but it's all based on when the loss occurs. So if the letter says November 1st is when it was printed, but you don't lose it until December 31st, the December 31st date is more important in terms of your enrollment period window. The same thing applies for when a plan exits the market. So you may have received a letter that your plan's ending back on October 15th or something. But if that plan's not ending until December 31st, that's the date that matters when it comes to your election into something else. And the reason that's important is because if you're an individual that didn't make an election during the annual enrollment period and you have a plan ending on December 31st, you still have an opportunity now to still make that switch before January 1st takes place. So that's why that date matters.
Okay, perfect, perfect. So, and again, because the plan is exiting that particular area, they have a guaranteed issue right to, if they've had a Medicare Advantage for 5, 10, 20 years, their company is dropping them. So don't they have a special opportunity to go back to original Medicare and get a Medicare supplement plan?
Correct.
Perfect, perfect. Yeah. So a lot of people are hoping that they were. A lot of people saying, I hope they cancel me. I hope they cancel me so I can go back to original Medicare." So,
Yeah, there you
all
go.
right. Yeah, another question here. Can I drop my Part D plan now without penalty? Is it possible to reapply later?
Ooh, okay. There's a lot to unpack with that one. It like a follow-up question I would ask to this particular person is, do you have prescription drug plan coverage elsewhere? And the reason that's important is because for every month that you could have had coverage for Part D or prescriptions, and you don't have it, there is a penalty that continues to build on the back end. So one day when you reapply for coverage, as you mentioned here, unless you've had credible coverage, you're going to have a penalty of 1% of the national average premium for every month that you could have had coverage. So it's not advisable unless you have coverage elsewhere.
Okay. All right. Yeah. So that's always hard. It's easy to explain. Okay, if for Part B, if you don't sign up for when you're supposed to, you're going to get a 10% penalty for every 12 months. And 10% of what? Well, 10% the monthly premium. So $185. So it's what, $18.50 for if you were 1 year
Mhm.
late. The Part D penalty is a little bit difficult to kind of because I guess they adjust that every year, and it's 1% for every month you did not sign up when you were supposed to, right?
Correct. The lovely folks at the Social Security office would have to help calculate that for you.
Yes, yes, we've got really big calculators. So, all right. Kathy says, I'm attached to my husband's insurance, but I checked and I'm being charged 100, probably $185 starting this month for Part B. I'm not sure what to do. Help, please. So, what should Kathy do?
So first thing I would do before making any changes is confirming that the insurance you have through your husband is considered creditable coverage. Simply answered by seeing if they have more than 20 employees for it to be creditable, and maybe just a quick call to the HR department to get that. And then what you'll want to do is you'll need to fill out a form, and I'm trying to think of that form to disenroll in Medicare, but you'll need to send a form into your Social Security office to disenroll in Medicare. And I don't know why that number's escaping me right now, but I'll find that for you guys.
Yeah. Yeah, that's we used to print them off. We used to add our own little language. Some offices use a different form, but there is a generic kind of form. But we kind of adjusted our form a little bit in our office. So some offices use a different one. But it's basically, yeah, it says I don't want Part B, and it gives you the whole thing down there that kind of, hey, you understand that if you're just refusing Part B because you just don't want to pay it, if you choose to get it in the future, then you're going to have to pay the 10% penalty and all that kind of stuff. So we kind of rewrote ours in my particular office. So my Part D was free for 2024. Advantage 2025, it's $47. So did you see, you and your team see a lot of increases in terms of monthly premiums, the kind of the declining of benefits, like days in the hospital and charges, and overall, what kind of trends do you see for particularly Part D or Medicare Advantage plans?
Yeah, so for the Part D purposes, it was very commonplace to see plans that, for lack of a better way of saying it, they were playing a little bit of a chess game last year to try to see how many people they could get over to their side, knowing that the plan premiums were going to go drastically up in 2025, and that's kind of what you experienced there. Was you got to take advantage of the $0 premium for this year, but now that there's a $2,000 max out of pocket, some of that burden's got to come back on to the consumer. And in this particular case, it came to the tune of $47 per month. So
Yeah,
it's very common occurrence that we saw across the board with Part D for sure.
perfect. What's smoothing?
Ooh, smoothing. So for those that take a lot of prescriptions, or maybe they take an expensive prescription, you want to be able to try to potentially smooth your premiums out throughout the year. So you could reach out to your Social Security office and let them know that you'd like to take advantage of the prescription smoothing program that's available, where instead of having to pay like a deductible at the beginning of the year, or maybe you pay $2,000 for a single prescription fill, you can instead spread that out over the course of 12 months, and it's a little bit easier to budget for.
Yeah, perfect, perfect. Can you also reach out to the Part D plan you have?
Yeah, we can certainly help with that process. We have a team of prescription drug plan specialists that can walk you through how to apply with it if you feel like it's cumbersome, and we can definitely get you in the right direction there.
Perfect, perfect. Kevin says, "Love chapter. So glad Thomas has joined it." All right, good deal. I like it. Let's see. Jumping around a little bit here. What about Medicare supplements? You see a lot of people switching to Medicare supplements for 2025, and what type of prices are we looking at for increase year over year?
Sure. And increases in pricing is going to happen at different times of the year, depending on who the carrier is. Like you have some supplement carriers that'll increase pricing in June, July. You'll have others that may go a couple of years without increasing their pricing. It really depends on how the company you went with set it up, because there's three ways to rate a policy. Either you do attained age rated, which is the most common, which goes up incrementally every year based on the age that you have now attained. You also have issue age, which is the price is set based on the age of which you apply. So if you apply 65, it might be a lower starting point versus when you're 75 just signing up for it. So that could be different there. Usually those are more expensive because of that. And also, those can still go up based on inflation, and they do go up as well. The third and other way is a community rated policy, which means everybody in your county or in your immediate area is paying the exact same premium. Those also go up based on claims and inflationary reasons, not for you individually, just for the region as a whole. So that's the way that the pricing is set up. You can certainly change that at any point in the year. And yeah, so from a pricing perspective, that's kind of what we're looking at there.
Okay. Yeah. So when you get a Medicare supplement, a Plan G is a Plan G is a Plan G. It doesn't matter what company it is. It's all about pricing. Correct.
That's correct, and there's still a little bit of an element where you wanna make sure you're still going with a good company, because, when you start looking at pricing, maybe you see a company that you never heard of that offers the lowest premium in the area. You get in and you sign up for it, and then 3 years later, they've increased the rates significantly faster than other carriers in the area. Now they're most expensive. So you have to be careful with those teaser rates you might see right out of the gate. So it's important to not only find one that's affordable from out of the gate perspective, but somebody that you trust to give you a very similar premium growth structure over the course of 20 to 25 years.
Right. Okay. So yeah, you have to watch out for that. I always say that the Southeast Texas Regional Firefighters Plan G or something like that. It probably has like 15 people in it, and it's like, oh yeah, well, $1 a month, and then next year it comes up to it's $3,000 a month or something. So I'm not
Sure.
picking on Texas just because I got Thomas here with Clemson. So all right. Savannah says I'm currently on SSDI, so Social Security Disability, turning 65 next October. When I apply for a supplement, is there any special process for me since I'm already on Medicare Advantage? Do I need to cancel Medicare Advantage?
All great questions. First off, congratulations on getting close to 65 next October. That does open up that special window for you to get a supplement without any kind of medical underwriting. So that process will take all of 15 minutes for an application. It'll be very smooth for you. You'll have your Medicare number ready to go. So everything they need is right there. With you being on a Medicare Advantage plan, the way you disenroll from that is once you're done with the supplement and that's been approved, you would then go through the process of applying for your prescription drug plan. Once you've submitted that application, that'll take care of the disenrollment for your Medicare Advantage plan. So there's no additional calls that you need to make. So once you've enrolled in that prescription drug plan, that'll automatically disenroll you from the Medicare Advantage plan.
Perfect. And that's what I see a lot of people making a mistakes on is they sign up for a Medicare supplement plan and then the person says, "Okay, let's go ahead and get you a Part D plan." And they say, "Oh, no, I don't take any drugs. I don't want one of those." And then they get the penalty for the rest of their life. So, it's sure if you don't take any prescriptions or something like that, just get the cheapest Part D you possibly can. And because you can change that every year. So people should kind of check that every year. If you start taking more medications or something. But most people stay on their Medicare supplement pretty much forever. Why would anybody go from one Medicare supplement plan to another?
The most common reason is kind of going back to the point earlier, where if you chose a company that's maybe lesser known, you're like, well, they had a great rate coming out of the gate. I'm like, I'm saving a ton of money here, but then fast forward 5 years, and they're now triple the cost of if you'd gone with more of like a steady type of company. So that would be a common reason. Another reason might be you were living in New York, which is one of the most expensive Medicare supplement rates, and now you move to South Carolina because you wanted a little bit more warmth, maybe four seasons. You got your toes in the sand at one of the beautiful beaches. And South
Mhm.
Carolina just also happens to be one of the cheapest states for a Medicare supplement plan. So you want to lock in a lower rate. So there's reasons to do so. But once you get to a point where you're happy with your supplement plan, that's what you're going to be with for the remainder of your time with Medicare. And it makes it also very easy for your family too. If you expect family members to take care of you one day, there's no hidden things that they need to worry about.
Yeah, that's a great thing about Medicare supplements is you don't have to deal with prior authorizations and networks. I always say the network is America. Any doctor, or hospital, clinic that takes Medicare takes whatever Medicare supplement, even the Southwest Texas firefighters Medicare supplement plan, if there is one. And you don't have to deal with them, ask prior authorizations. Basically, from what I understand, the system works. The doctor submits it to Medicare. The Medicare computer system talks to the Medicare supplement plan, and the Medicare says, "Hey, we coughed up the 80%. You owe the other 20%," and the computer system pays it, and pretty much that's it, right?
That's correct. Yeah, the doctor's office and hospital should never have to worry about billing the supplement plan. That'll be taken care of by Medicare.
Could you imagine if everybody had a Medicare supplement plan, how much the doctors could save? And, because you look at a doctor's office, you got the doctor and you got the person at the front desk and reception, but then you've got 15 other people back there. What are those other 15 people doing? They're going through prior authorizations and trying to get paid and this and that. If everybody had a Medicare supplement plan, then I hate to say it, 14 of those people would, well, they'd go help the doctor provide health care, right?
Of course, or maybe they're working on the under 65 crowd with
Yeah.
the ACA plans and the employer coverages still.
Exactly, exactly. Okay, eTruth. Hello, Dr. Ed and Thomas. Thank you for the welcome card and ribbon. I received the joining for chapter. I was able to get a reasonable supplement plan G and enrolled in A, B, D plans. Thanks you. Thanks to Ed, I found you grateful. Awesome.
That's
Another
awesome.
great response. Yeah, I think the only negative we had about chapter, which was the negative everybody had this season, was there's nobody, I call up and it's hard to get someone to talk to because the Medicare season this year was just horrendous because of, those millions of plans being canceled and all the craziness of it. And unfortunately, nobody had enough people. I mean, that was nationwide.
Yeah.
But y'all did a phenomenal job, dealing with that. So y'all definitely need a vacation. All right,
Well, thank you.
let's see. Let's see. If I continue to work in 2025, how much can I make, and can I receive divorced spouse? And still, okay. Well, a little Social Security question here. So, if you're under your full retirement age, then for next year you can make $23,400. Anything over that, Social Security is going to hold back $1 for every $2 you go over. And can I receive divorced spouse benefits? Yeah, if you were married to that person for 10 years or longer, and your benefits are less than half of their benefit amount. And remember, they don't have to be receiving benefits as long as your ex-spouse is at least 62 years old. It doesn't matter whether they're receiving benefits or not. It's called independently entitled divorce spouse benefits. So please make sure you like and subscribe and share and all that kind of stuff, because there's just way too many people that are receiving the wrong Medicare benefits, signing up at the wrong time, being penalized, not getting their spouse benefits, divorce spouse benefits, surviving spouse benefits, their retirement at the right time, the right amount of, yeah, the whole thing is just crazy. And that's why we're making these crazy videos for y'all, to make sure you get everything you earned. So Michael says, I didn't sign up for Part B because I was on Medi-Cal, which covered everything. I expect to lose that coverage in a few months, but wonder why that coverage doesn't qualify as credible coverage. You want to try that one, Thomas?
Sure. As far as the why is not considered credible coverage, I mean, that's a great question. I'm sure there's some sort of political answer in there somewhere. But what I can tell you is that it is factual that it is not credible coverage. So, what you're going to have to do to fix this is between January 1st and March 31st, you're going to need to take advantage of the general enrollment period window to sign up for Part B. And at that point, try to see, you expect to lose that coverage in a few months. You'll have a special enrollment period to pick up additional coverages once that Part B has been approved. But long story short, I don't know the why behind it not being credible. I just know that it's not.
Yeah. Yeah, that's another confusing thing, because you've got the general enrollment period for Part B, and then you've got the open enrollment period for like Medicare Advantage and Part D and stuff like that. So, and they're the same time frame from January 1st to March 31st. So during that time, you can sign up. If you didn't sign up for Part B before, you can sign up during that time. If you sign up in January, your Part B will start in February. If you sign up in February, it'll start in March. They changed the law about a year ago. It used to be if you signed up during that 3-month period, your Part B would start in July. They finally changed that law that it starts the next month. But that is separate than what Thomas and I are talking about here in terms of Medicare Advantage, kind of a mulligan do-over, change your mind. You can only do that one time, right?
Correct.
All right. Let's see here. Thank you for all you do. My husband retires as of January 1st, but in September he was hurt at work and is on workers' comp. His first Social Security check is in February. Will workers' comp affect his Social Security check? No, it will not. Sounds like he's just receiving just regular Social Security retirement benefits, so workers' comp will not affect Social Security at all. If he is under his full retirement age, if he stopped working because of a disability, an injury or something, um, I would definitely check to see if you want to file for disability benefits. So you can file for retirement benefits and disability benefits at the same time. You won't get both; you'll get the higher if you're approved for disability. But if you're approved for disability, that is one thing, the workers' comp, it will offset a little bit, or depending on how much workers' comp you get. So if you get a workers' comp or what's called a public disability benefit, that will offset your disability. If you get like a long-term, disability or something from a private company, that doesn't affect your disability, but a workers' comp or a public disability does. So, Mary, I would check out, and why do people enroll, file for retirement and disability at the same time? Again, between 62 and their full retirement age. Why would they do it at the same time? Because The Social Security Administration is at a 50-year low of staffing, and it's taking forever. So if you apply for disability today, you're lucky if you get an answer back 6 to 9 months. And most people just can't wait 6 to 9 months for a check coming in. So they go ahead and file for retirement, early retirement, to get that money coming in while they're waiting for their disability to be approved. And why would you do that? Because if your disability is approved, that's high. You'll get a higher amount than if you took your retirement benefits early. And you get your Medicare earlier. So if you start your retirement at 62, you have to wait until you're 65 to get Medicare. If you're approved for disability at 62, you get your Medicare 2 years after. So there's a lot of, I would definitely kick that around, Mary, you and your husband, and see if, see if you want to do that. All right. Why under Part D does my medication cost $500 a month while in Honduras the same medicine is $15?
Hmm. I can't really answer that question very well. It's just all based on what the retail costs that are set here, and then what is covered in terms of the tier that you're set on for Part D. So that's a fun question for sure.
Yeah, I mean, and not in Honduras, prescription drugs. Yeah, you see this on the news all the time. You go to any other country in the world, and the same company, the same pharmaceutical company, charges 10% what they charge in the United States. And so, yeah, there's an attempt now to be able to negotiate drug prices. They just started with the first 10. So hopefully that continues. Dr. Weir cannot say enough with gratitude for your help. Also, Chapter is wonderful. They helped me with another plan, would have still been waiting around in all the confusion otherwise. Thank you. Awesome. Good deal. Yeah, that's a good way to put it. Waiting around in all the confusion. Yeah. Because there's not only when can you enroll, it's what you can enroll in, and what the pitfalls you need to watch out for, and all the rest of it. So yeah, um, it's good that we have Chapter there to help out, so people can actually, enjoy their retirement. Unlike me, which I suck at retirement, obviously. That's why I'm here. How much is the cost of a Medicare supplement?
So there's going to be a couple factors that's going to dictate what the cost is, like how old are you at the time of applying, as well as there's occasionally, depending on the state, male or female may have different rates. Whether or not you smoke or do not smoke can also affect that rate. But at the end of the day, it's going to really mostly depend on what state that you live in. For example, as I mentioned earlier, South Carolina, North Carolina, Virginia, Pennsylvania, Georgia, those can be very inexpensive states. If you go a little bit further north, like New York, Massachusetts, Connecticut, that's usually your more expensive, where it can get as high as like 450 per month. Whereas the southeast might be more like the 1 to 150 per month. Or if you happen to live out west, it could be closer to that 150 to 200 per month. So it's a pretty wide range. So as long as you're not in one of the three expensive states, which is usually New York, Connecticut, Massachusetts, you're going to see something between maybe on average 150 to 200 per month.
Yeah. And then you also have to get the Part D, the
Right.
prescription drug, right? And then
Yeah,
and none of that covers dental, vision, or hearing, right?
that's correct.
Yeah.
So, well, I will say on the vision part, if you have like an ophthalmology issue where you like a glaucoma or cataract, that is covered by Medicare plus your supplement. What's not covered on the vision side is the optometrist, which is when you go get your routine eye exam.
Okay. Do y'all help with dental plans, vision plans, or anything like that?
We don't. That's not an area that we feel we want to be experts in. What we usually tell clients that ask for a standalone dental or vision is first place to check is go ask your dentist, because most people want to be able to keep their dentist, and a lot of dentists back in COVID, interestingly enough, I don't know if there's any correlation there, but they stopped taking insurance and started offering their own internal products. So you may not even need to get an insurance product for the dental coverage if you have a specific dentist you want to use. And then on the vision side, if you want to cover your routine eye exam and maybe get like a benefit towards the purchase of glasses, you can get some inexpensive plans with VSP, Victor Sam Papa, or iMed, which are the two major carriers for vision insurance. But bottom line, you would just reach out to them directly.
Perfect. I love that answer because, yeah, there's a lot of Medicare, insurance agents out there that make tons of money, enrolling people in dental and vision plans and stuff like that. And I've always been, It's yeah, it's the doctor, and sometimes you can do a cash deal with the doctor. And do you really need that much? Because for the dental stuff, you really don't get any coverage really for the first year or two until you start paying into
Exactly.
it for a while. And yeah, so yeah, I love that answer. Good answer. All right, can Advantage change the tiers from year to year for the same medication as 2024? Do all Advantage plans change the tiers?
So the short answer is yes. Now, of course, there's the five traditional tiers that go from preferred generic, generic, preferred brand, non-preferred brand, and specialty tier. Those are the traditional five tiers that you see for prescription drug coverage. Now, a specific prescription can go up a tier. Maybe it goes from being a brand to a preferred generic. That happens occasionally, especially when a generic does come out and you start taking that generic. So it is possible that it can change from year to year. We don't see it too often, but that's very important to when annual enrollment period does come around. If you're seeing a change in cost, that's when you want to reach out to somebody like us. If you want to explore, well, does another company treat it differently? Can I save money on this and still be able to keep my doctors and still be able to have the lifestyle that I want to have if I save money here? So the short answer is yes, it can change from year to year. It doesn't happen too often, but you should absolutely be checking every year to make sure that other plans are maybe treating it better.
Yeah, perfect, perfect. All right. Someone asks if Plan G covers the Part B deductible.
It does not. That is the one element of the Part B coverage that is not covered under a Plan G, is that
Okay.
deductible.
All right. All right. Let's see. Someone's turning 65 in July. So when should they start looking at all their options if they're turning 65 in July?
In the event that they do need to come onto Medicare, I would say the sweet spot to start looking is about May. So beginning of May, you can do as early as April, but sometimes that can be really far out in terms of waiting for some things to kind of come through for you. I would say May is the sweet spot there.
Okay. All right. Let's see. We'll do our final question here. We're running out of time. Can I enroll in Medicare 1 year, then not accept Medicare the next year? So we're probably talking about Part B. So can you get Medicare Part B? And some people go back to work and get health insurance from work, and then they go back on Part B again. Do they get like a separate, a second opportunity to get a supplement or advantage or whatever?
Sure. So just to first answer her question on the 1 year and then not accepted the next year, there's usually not an acceptance that you have to go through with Medicare. It's automatically going to continue as long as you pay the premium. If you want that to stop because you did pick up credible coverage, going back to an earlier question about it, when I couldn't think of the number, I did look it up. It's the Form 1763 with CMS in order to request termination of Medicare. You would need to go through that process and detail why that is. When you do come back to Medicare down the road, to your point, Dr. Ed, it wouldn't be a new open enrollment period with most carriers because you've had Medicare in the past. However, in a vast majority of situations, you're probably going to have a guaranteed issue window because you're losing credible coverage elsewhere. So, more than likely, assuming you stopped Medicare because you had coverage because you went back to work, you're probably going to have a GI situation when you do start Medicare back again.
Okay. The whole thing is just way too confusing, isn't it?
There's a lot of moving parts, but we try to simplify it based on the individual conversations we have.
There you go. All right. So when somebody calls you, you just get their zip code because that determines what plans are available in their state and area, and then you ask them a series of questions and talk to them about the differences between Medicare supplements and Advantage and the whole 9 yards. Right.
Exactly. Yes, sir.
It's about how long does a normal conversation take once people give you a call?
Sure. So for an individual consultation, they're usually going to be between 45 minutes to an hour to get the majority of it done if you're looking to have that enrollment happen on that first call. And oftentimes we have spouse situations where we're doing two consultations at once. You may want to book a little bit more time for that, maybe an hour 15 to an hour and a half to make sure we take care of both of y'all.
Okay. And they don't have to schedule; they can just call that number
And
right
call,
there, and right.
yeah, they can call right in and we'll take care of them.
Okay, perfect, perfect. And one of the things that, yeah, make sure you don't miss your don't get penalized. That's our number one thing here. Don't get penalized. Don't get stuck in a plan you don't want because you waited too long. So information is always a beautiful thing. and chapter has the information there. I'll help you all out with all things Social Security, retirement, survivor benefits, Part A, Part B, all the rest of it. That's why we were getting help from chapter there, and y'all do an excellent job. And I thank you, Thomas. You have yourself a great day.
Thank you so much, and happy holidays.